The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello folks, I'm Kate Ball and I'm the founder of Mini First Aid, and welcome to our podcast Family Health by Mini First Aid. Now I am delighted that you've taken the time to listen to our podcast, because whether you're in the car, you're out for a bike ride, maybe you're cleaning the house or even relaxing with that well-earned cuppa, our Family Health podcast covers a huge range of topics that might just affect one of your family members. And if you've ever got a family health concern and you're thinking, do you know what, I'm going to just Google that, please don't. Please have a listen to us instead. Now today, we're in series 5 and we've got a brilliant topic today that affects so many families, either directly or indirectly, excuse me, and that is allergies and anaphylaxis. At our classes, we urge every parent to have an awareness of severe allergies, because you might find yourself hosting that play date or party with a child who could become seriously ill if they eat or are exposed to the wrong thing. So there are all sorts of things that I want to ask Helen today, and I am delighted, therefore, to welcome Dr Helen Evans-Howells. She's a trained GP with a master's in allergies, and she now runs a private allergy clinic and is a trustee for Anaphylaxis UK. So welcome to the Family Health Podcast, Helen.
Well, thank you for having me today.
Helen, we've got to know a little bit more about you, because I've done the intro there and that all sounds very grand, but tell us a little bit more about you and how you got started in this arena of allergies and anaphylaxis.
Yeah, so I think, like many GPs actually who keep reaching out to me asking, how did I get into doing my job? It's because of personal experience. So I have 5 children, 3 biologic children, and when my first was born, Ethan, who's 16 now, he had milk and nut allergies basically, and it led me down this journey of realization that I just knew nothing about allergies. And I look back, so I was a doctor at the time, I was training to be a GP, so I wasn't a fully qualified GP yet. But actually at that time, food allergies, believe it or not, were not on the curriculum for GPs to know about. And that's only changed in the last few years. And so I'd go back and forth to his GP, who's lovely, and we did get a referral, and then back and forth to his consultant appointments with all of these things I thought were great ideas that I'd done for his care. Like give goat's milk, which is almost identical to cow's milk. So, of course, he'd reacted. And eventually, when he had anaphylaxis that I hadn't recognised, his consultant said, I really think you should do some more training. So in true me style, I went back to university when I was heavily pregnant with my third. And I have to say, just really found the thing that I am incredibly passionate about. So I worked with Southampton Allergy Team for 5 years. Then COVID struck, so I did a lot more general practice work and looking after people in the community. And then I thought, do I really want to get back into allergy? And perhaps it's hard to get contracts within an NHS setting when you're a specialist GP. But also there were things about that I wanted to change. So I set up Dr Helen Allergy, seeing children and adults with food allergies. I've been the chair of the primary care group of the British Society of Allergy, and with my colleagues, we managed to get food allergy on the curriculum for GPs now. So that has really changed. And we now offer we're one of the only clinics in the country offering immunotherapy, which helps children desensitize against food allergies. So I've become incredibly specialized, and it's really interesting as just a human when you look back at like why things happen to you in life, or why did that career path not happen, where why did I do this and that, and you just realize it was to get me to this point. And we as a family live and breathe allergies. Ethan actually outgrew his food allergies, but we still have allergic conditions within our family. But we're just really massively passionate as a whole family. My sister-in-law's in the company, my mum, my husband runs it. just to make people's lives better when they're living with food allergy, because it has a huge impact on quality of life.
So I think, folks, we can be very confident here that we're in very good company with Helen, and what Helen doesn't know is therefore not going to be worth knowing. So Helen, I have read or I've seen that allergies or severe allergies are becoming more common in the UK. Is that true? Have you got statistics for that, or is that just something that's been hyped by media?
Yeah, no, it is true that food allergies have, and general allergies as well, so environmental allergies have increased over the past kind of 10 years. It's always really tricky with data because you rely on accurate diagnoses being made. And as I've just alluded to, unfortunately, quite a lot of healthcare don't really understand allergy very well. The best data we've got was published, I think, last year from Paul Turner, who, now he's a real expert. I love listening to him talk. And he basically looked at, I think, over 7 million primary care records. And they looked at people with a diagnosis of possible food allergy, probable food allergy, or probable with an adrenaline auto-injector. But what they could see is, compared to previous data, the incidence had sort of doubled from the past 10 years, from I think that was 1998 to 2018. So it has definitely risen, because I think that's the best data we've got. And we could assume that most people with an adrenaline auto-injector at least have got true allergies, because there's often problems with misdiagnosis, inaccurate diagnosis, underdiagnosis. It's a really complex field, to be honest, because there's just not enough specialists. But it certainly looks like, yes, food allergies have risen. Cases of anaphylaxis have definitely hugely risen, and admissions. But thankfully, because this is the bit that families really stress about, and adults with food allergies, the death rate has gone down. And so I think that's really important. Despite allergies increasingly common, it is very, very, very rare to die of food allergy.
Okay, that's reassuring. Now, just to make sure for everybody listening, when we always want to simplify terminology, and so that everybody is clear.
Yeah.
Just in simple terms, then, what does allergy mean, and what does anaphylaxis actually mean? What does that mean?
Yeah. Okay. So an allergy is an abnormal response from our immune system. So it is recognizing something that should be harmless, like milk, sesame, peanuts, grass pollen, as harmful to the body, and it sets up this response that will give you quite defined symptoms within set periods of time, and that's allergy. And some allergies we can test for, and some we can't, and it's about pattern recognition. Now, anaphylaxis is actually tricky to simplify, because it depends on which country you're in as to what the definition is. But broadly speaking, we all agree that it is a severe, life-threatening systemic reaction, so something that's happening to your whole body. So in the UK, we look for ABC symptoms. So A is for airway, so persistent coughing, voice going croaky, tongue swelling. B for any signs of breathing problems. And C is for sort of circulation conscious levels, so dizziness, pale, collapse, chest pain. Often people feel a sense of doom. That's anaphylaxis in the UK. Interestingly, in America, they say it's anaphylaxis if there's two system involvement. So if you've got skin signs of swelling and you vomit, they would say use adrenaline. Now, I think what's important to recognise there is that their death rates are not different. And so even though they're perhaps more reactive in treating anaphylaxis than us, the overall change to outcome is not different. And I reflect as a parent, because Ethan had quite a lot of accidental exposure to milk. He would have probably had his EpiPen a lot if I'd gone with that criteria. So for me, that doesn't necessarily feel comfortable. However, it really is important for families to know that using adrenaline is very, very safe when it's given in the muscle. And if you're in a position of going, oh, should I use it? Then probably the answer is yes. Because if you feel like that, it will make that person feel better very quickly, and it doesn't actually matter. These are just semantics of should we or shouldn't we give it. It just doesn't matter. It will reverse the reaction.
Can you get anaphylaxis from your very first allergic reaction, or does does it tend to build?
No, you can. There's so many myths around this topic, and unfortunately often driven by healthcare. And that's the real challenge that families face, is that, and adults with allergies, you'll go to one person who'll tell you one thing, and someone else will tell you something different, and socials will tell you something different, and you just don't know who to believe. And that's really challenging. So it is a myth that if you've never had anaphylaxis, you can't have anaphylaxis. And it is a myth that your reaction gets more severe with each exposure.
Right,
So
because that's what I've heard. That's,
yeah,
that's what you tend to hear bandied around, and that's questions particularly we get asked at first aid classes. So you can't have anaphylaxis at the start. It's going to get worse and worse and worse, and then you will. And
I
that's
know.
not the case.
That's not
Okay.
the case. And what happens is you go to A&E and they say, oh, next time this could kill. And like, actually, statistically, I could tell you that's extraordinarily unlikely to ever happen.
Right.
And that narrative is really important, not because you're undermining allergies, but because your parents set up right from the beginning of, oh my God, they're going to die. And I remember that feeling. And it's,
Hmm.
you know, pretty much everything else you do in life is more risky. But it is not to undermine that, people can die and they do die. But it is rare. But basically, you're more likely to have anaphylaxis if you've got something called a cofactor present on the day. So that is like, I always describe it as the perfect storm. So if your body, if it's fighting an illness, so you've got a cold, cough, tummy bug, if you eat more of the food you're allergic to, if you've run around just before or after, if you have asthma, particularly if it's badly controlled, if you're stressed, if you've had alcohol, if you're around your period, if you're fasting, if you've taken ibuprofen, all of those things can trigger a reaction to be worse on one day and on another day less severe. So
Okay.
Ethan's reactions often used to be hives and swelling, sometimes a vomit, and it was quite classic. And so I guess I'd fallen into a path of, oh, it's hives, it's all right, he'll have some antihistamine. When he had anaphylaxis, it's because he had unrecognized asthma at that point, and he was having sort of uncontrolled symptoms from that. And also he ate a larger quantity because I was not good, did not check the label. We were abroad. I assumed that something wouldn't have milk in. So I gave him sausage from a self-catering thing, a hotel thing, sorry. And it was chorizo, which contains fresh milk. And so he ate the whole lot. And that's what triggered the persistent coughing, swelling. I didn't realize. So I gave antihistamines and his inhaler, and he got better because crucially, we do produce adrenaline when we're stressed. And so 8 out of 10 episodes of anaphylaxis will self-resolve.
Right.
But
Okay.
we know that the key thing is the sooner you use adrenaline, the more likely you are that you will reverse the reaction. If you leave it, you might go past the point of no return. And no parent or adult or any family member wants to be left in a position of what if? What if we'd used the adrenaline instead of the inhaler? And I know people who have died, their family members. A good friend of mine runs the Sadie Bristow Foundation. It's hard to live with that forever. We want to make sure the circumstances, we give them the best opportunity, and that's why adrenaline is so important.
So let's go back then to sort of when children can develop allergies. Is there a time that it's more likely to happen? Are children born with their allergies? When does it all develop?
Yeah, we're not born with allergies actually. So that's another little myth that,
Okay.
people will say right from the beginning. So we're not. Depends on the types of allergic responses we're talking about. So there's lots of different subtypes actually. It's becoming increasingly complex, but the most common ones people see are the ones that we recognize, which gives you potential anaphylaxis. So you eat cashew nuts and within minutes to hours you get hives, so a nettle sting like rash, swelling, tummy pain, vomit, diarrhea, sneezy, and possible anaphylaxis. And those ones you can test for. And commonly they'll present at weaning or onwards, but they can happen even into adulthood. Delayed non-IgE allergies are very, very challenging. They occur 2 to 72 hours after exposure to the food that you're allergic
Wow.
to, making it very hard to figure out what's going on. And they tend to occur at about the age of 8 to 12 weeks if you're formula fed. It can happen in breastfed babies, but less common. So sometimes what will happen is that when breastfed babies are introduced to formula, they might start reacting. And they give you symptoms that cross over with symptoms that can happen in a normal baby, for want of a better word. So reflux, miserable, screaming, tummy pains, diarrhea, blood in the stool, mucus in the stool. Constipation is now being recognised. Difficult to manage eczema. And if you're on the severe spectrum of disease, it doesn't mean that milder symptoms don't affect that baby, but then you might have growth issues as well. And so they tend to occur at the age of 2 to 3 months of life, whereas the IgE allergies, often you'll start seeing them at weaning.
Okay. And those common allergens in the UK, what are the ones that are most common that you see in practice most frequently?
Yeah, so we've got like the top 14 that are labelled, but it's
Okay.
interesting really because actually in practice the top 14 are not necessarily the top 14. And I do think that we might find that those things change over time. And there's also some myth around the top 14. So, for instance, you've got sulfites on there. So, families who want to introduce their family to all these allergens, things you can be allergic to, will say to me, how do I introduce sulfites? Well, actually, sulfites are more for a subset of disease where it sort of produces what looks like allergic reactions, but they cause more respiratory issues. And therefore, people with sulfite intolerances, difficulties, really, it's labelled to help them, but it's not actually something that triggers a true allergic response. So there's a bit of a myth there around that. So the commonest things we'll see: milk, egg, peanut, sesame, tree nuts. So tree nuts are not the same as peanut, which is actually a legume, not a nut. So things like cashew, hazelnut, almond, walnut.
Okay.
You do have soya and wheat in there, but they're not super common. Fish, yes, I see a bit of fish. Shellfish tends to affect adults more actually than children, so that's something that comes on in life. What else have I missed? I think those are the main ones off the top of my head. But these days I'm seeing increasing allergic reactions to things like peas, lentils,
Peas. Oh my gosh.
chickpea.
Right.
And we think that has come about because we are looking for more plant-based alternative foods or wheat-free foods. When you take wheat out of something like bread, you need to replace it with a different flour. And so people are using things like chickpea flour, lentil flour, and that change in exposure seems to be making a big difference. And my colleague in Scotland said that on the Western Isles of Scotland, they have so much pea and lentil allergy, and it's incredibly difficult to avoid pea because pea protein is added into so much food like chicken nuggets, chips, Twister ice lollies. They have caused so many episodes of anaphylaxis. Sorry to
Wait
say,
a minute.
Trista.
Twister ice lollies
Twister
have
ice
pea
lollies.
protein in.
Pea
Wow.
protein in, yeah.
Wow.
And that's why when you have these allergies, you really, really need to have a proper assessment with someone who knows what they're talking about and can tell you all these places of be wary of the Twister ice lolly scenario. Because if you're just given a label of, yeah, I think you're allergic, just avoid it. That's very hard to do. A lot of education needs to come around how to read food labels, where to look, what to do about cross-contamination. And I reflect back and think, I never had that. So although it seems like it's common sense, I didn't know how to read a food label. And that's why Ethan had so many allergic reactions.
I've got so many questions for you, Helen. We could talk all day, but there is a question for me because we in our mini first aid classes quite often meet parents and carers just as they're about to go on their weaning journey. And hearing this, there must be, well, I know just from talking to parents, this heightened anxiety because
Totally.
you are going to put something into your child's mouth that until they have it, you don't know if they're going to be allergic to it.
Yeah.
And so it's sort of, we want to inform people, but at the same time, we don't want to frighten
Cause
them.
mass panic. No.
Yeah, absolutely. So if a parent suspects that their child has an allergy, so perhaps we could recap again some of those symptoms for allergy.
Yeah.
What do they do?
Yeah.
Where are they going? And so as they are listened to and not sort of fobbed off
Yeah.
for inaccuracy of information. What happens? What's the route?
Totally, because what happens for these poor families, because we support a lot of them on an online membership subscription where they're just in at the weaning journey. They just like get in this frozen state of, I don't want to give food. And of course, because who wants to cause their child harm and risk reactions? And it's really very difficult for them. So so what I explain is, to make people feel hopefully better, there has been one recorded death in 20 years in the under 1 age group. And the baby had actually a background of respiratory issues as well.
Okay.
So in part, getting the food in early, part of the reason we're asking you to do that is because actually this is the safest time when it comes to food allergy, is to give your child food. When you wait, the highest risk time of severe reactions is in your latter teens and early 20s. There is also a piece around, we know that if you are higher risk for food allergy, so that will be people, particularly where the infant themselves has eczema, they do have a slightly heightened risk of then developing food allergies. So we ask you to consider weaning them early with things like peanut butter and eggs, because actually we know that you will massively reduce their risk of allergy forming. So a great study that showed if you introduce infants early to peanut butter, peanuts, you reduce their risk of allergy from 35% down to 10% in those that have eczema. And the reason I'm asking you to do something stressful is because you might prevent allergy and stop your child becoming in that high risk category in the teenage years. And also, of course, we do have to eat. And actually, dietitians really cringe if people are being told only introduce one food every 3 days. And this harps back for people that don't realise, because sometimes you won't react the first time. You classically might react the third or the fourth time. So some people have given this sense of if you give it 3 or 4 times and it's fine, it's definitely safe and you can move on to the next food. It's also not strictly true. And the problem with that is if you look at how many foods an infant would then be introduced to, it will be very limited compared to a baby who maybe the parents don't have this on the radar. They're just weaning happily with, normal like bolognese and some, whatever way you want to wean your child. And the reason that's so important is because it extends your gut bacteria. And there's so much emphasis now on the healthy gut microbiome and the importance this has on helping not only allergies and eczema, but also general health conditions, dementia, heart disease, diabetes, later life. So you're doing something protective, actually, even though it feels like it's going against the grain. So if you're super stressed about it, and let's say it's a food where everyone gets a bee in the bonnet about peanut, whereas some of the most severe reactions are actually from cow's milk. But what you can do is rub a little bit of peanut butter on the inside of the lip and wait 15, 20 minutes. If you get some of the symptoms, so to recap, skin symptoms of swelling, nettle sting-like rash, they might start to look like they've got hay fever, so they get sneezy, itchy, agitated, vomiting, diarrhea, or those anaphylaxis signs, coughing, voice change, tongue swelling, breathing problems, floppy, stop, call 999, of course, if they've got anaphylaxis. If not, and it's hives, you could probably wait and see, and it will invariably settle itself, actually. And usually, even by the time the ambulance has got there, most infants are better. But anyway, let's assume it's fine. Then give the tip of a teaspoon amount, then a quarter, then a half, then 3/4, and build it up over a couple of days, but carry on weaning. So most fruits, vegetables, rice, oats are quite low risk allergy foods, meat. So you could be doing a normal meal and in that meal introduce a new bigger allergen like peanut, sesame in a different meal, egg in a different meal. But only for babies where maybe there's a strong family history of allergies or the baby's got eczema themselves. Otherwise, I would just encourage you to try and wean in the path you wanted to, and know that even if your child has a reaction, and even though that's incredibly stressful, I've been there, they will get better.
Great. And so you talked about the hive type rash, which I guess is what some people might say or might associate with a milder allergic reaction. So they've not got anaphylaxis, so we're not concerned about their airway, breathing, etc. So we're not a 999 call, but we do want to seek medical advice. Where do we go? Is it the pharmacist? Is it our GP? Is it our health visitor? Where are we going if we think or we suspect that our child has an allergy?
Yeah, if you think your child has an allergy and in that moment it's resolved, then your GP. And as I say, hopefully they'll be better informed. And if you found that you had someone you really felt wasn't hearing you or listening to your concerns, or you're told nonsense like the NHS doesn't do allergy testing, 100% we do. Just nonsense. Or you can't have a referral. Well, you often can. There are some parts of the country where they might not see egg allergy because it often self-resolves and you'll be given information instead. If you felt like someone in your practice hadn't listened, ask the receptionist, is there a GP in the practice who's really good at allergies? They will often know who the person is to see and maybe ask for a second opinion. But most GPs will consider then prescribing Piriton, which is off license under one, but it is fine to use. But all that does is it blocks the histamine. So it will treat those skin symptoms of hives and swelling. But to reassure families, even if you didn't do that, it doesn't mean it's going to go on to anaphylaxis. So antihistamines just treat those skin symptoms or tummy ache. They do not stop anaphylaxis occurring. They do not mask severe allergic reactions, more myths. And it's not harmful in short-term use. So your GP would be able to hopefully teach you a little bit more about allergic reactions, give you the antihistamine prescription, and possibly then refer you on to an allergy service. But if someone says to you, okay, stop weaning all the allergens, or you've reacted to peanut, don't give any other nuts, I really, really would strongly advise that you ignore that advice completely and you carry on, because peanut is a legume. It's not a tree nut. 20% of children might be allergic to, say, a peanut and a tree nut, but you'll still often find that there are some tree nuts you can tolerate. And whilst you might think, as someone who maybe doesn't have allergies, well, what does it matter if you're just avoiding all nuts? I can tell you enough families and adults really want to know which ones can they eat and which ones can't they eat. Because with things like being vegan, for instance, a lot of it's based on almond, or, you know, the child might really want Nutella like their friends. And it just adds more anxiety when you've got more and more foods to avoid. So it's really important that you know exactly what to avoid. And allergy tests are only accurate if they go with a history. So if I just screened all of your listeners, about half of them will have positive tests and probably wouldn't have food allergies. They're only accurate if you said to me, every time I eat hazelnuts, I get a rash, swelling, vomit. Then if the test is positive, it confirms what I was already suspicious of. If I just tested all of the adult population to hazelnuts, a good proportion will be positive, because, this is more mind-blowing stuff, if you're allergic to tree pollen, sometimes you have positive tests to some nuts, fruits, vegetables, and they might give you just an itchy mouth without anaphylactic risk, or they might do nothing, but they certainly make the mix of testing muddled, and you need a specialist to understand that. So please don't allow anyone to blanket test your child if they've never eaten the food. It is just inaccurate. And what happens is you end up unnecessarily avoiding foods, potentially now causing harm, because the avoidance of them can mean that allergy forms.
So talking about testing,
Yeah.
so if you are referred for testing, you're going to have your history because you want to present, and you need to have as much information as possible.
Yeah.
What happens in the testing? So how is a baby or a child tested? What do they do to your baby?
Yeah. So top tips for your appointment: keep all your photos in a separate album, because you'll have photos, and that's brilliant. I want to see photos. If you haven't got photos, I get upset. And maybe write some little notes for yourself, because when any of us are put in front of healthcare, our mind goes blank. If you can, take somebody else to mind the child, because you know your kids will kick off. It's like, it's boring there. They've got to wait for hours. They'll get hungry, and you want someone to help you so that you can listen and focus and make notes. So that you'll usually see a specialist, be it a consultant or sometimes a nurse specialist or sometimes a dietitian who'll take the history. And then depending on the centre, they'll either do a blood test or a skin prick test. And there is similar accuracy. I like skin prick tests. So what we would do on that is, on the forearm, I write numbers so I know what I'm testing and what it's corresponding to. Put a drop of liquid that's got the protein of the food, so peanut, sesame, milk, etc. Pop the bubble. It really does just feel like you've got a pencil and just put it on your skin. It doesn't draw blood. I can tell you, babies don't even wake up. It's not painful, but toddlers scream because they don't want you holding their arm still, and they just get numb
So that's
without
the
you being in
reaction.
their space.
Yeah.
And if you've had it before, for some children and adults, if you get a lot of itchy welts, because what happens is you wipe it away, leave it 15 minutes, and if there's a reaction, you'll get a hive. And sometimes they can be quite big, and a child might remember, I felt very itchy for the 10-15 minutes till we read it again. And it's that they remember that means that they can have a really bad experience with this. But the actual procedure is much simpler than a blood test. And the nice thing is you get the results there and then. We can talk about it and you get a plan. So I prefer that method, and I hold the blood tests for people who the skin pricks haven't shown what I thought, or I'm thinking of a food challenge, or I need to explore further. Are you an adult who's got a positive test to hazelnut, but have you got this pollen cross reaction? There are specialist blood tests I can do to unpick that situation.
Okay, so you have, and then you have your diagnosis, and then you can start this process of being able to label read accurately, to not just have a broad brush where you could say I'm allergic to nuts, for example, when it's not. It's a particular. You can actually,
you know what to do. I mean, I would love to think that within an allergy clinic you'll always get full information about how to read labels. It's tricky. What I would say is, I'm trustee for Anaphylaxis UK, so them and the other allergy charity, Allergy UK, have got lots of fantastic patient leaflets. So just go on their sites, look at the topic you want to look at, So if you're now really worried about pea allergy, for instance, we've got a legume leaflet on Anaphylaxis UK. You can read more about it that will tell you specifics of where are you likely to find these foods, that with the best will in the world, I mean, I have an hour with my patients privately, but even then, there is no way I can tell you everything, and you won't retain it. You only retain 10% of information from, people will probably need to listen to this podcast back a lot to retain what I've
to
just
write
said
it
here.
all down. Yeah, absolutely.
So we just don't retain.
And we will put in the show notes the references that you've shared as well, Helen, as well. So if you're listening thinking, oh, actually, there's 2 charities there that I can go to for more resources, we will share those in the notes from the show. And I think, when you think about babies and children, we as the adult are in charge of their diet, right? So as people get older, you can make your own decision and say, I have this allergy, or, now if you walk into a restaurant, the first question you get greeted by with your server is, are there any allergies? Everybody's programmed to do it. But for children, until they're at an age where they can talk about it, the adult needs to know it. So I guess the more informed you are, then that helps them, because they're not just going to eat at your kitchen table, right? You've got to take them.
I just massively think that, our 2 strap lines for our business are live well with allergies and knowledge is power. Because yes, although I can now do this immunotherapy and help desensitize, etc., for many people, because that's private, it's not going to be on their radar. They can't afford it. The NHS is way behind and has no capacity. That's the sad reality. So we want everybody, though, to know, how can I still do everything in life that I plan for my child and family? So how can I eat out, travel, let them go to parties, play dates, go to school? Some people will now homeschool because of the anxiety. And I think a big bit of that is the education piece of knowing it is very unusual to die. We are all human. We make mistakes. Our children are accidentally going to be exposed either because of us accidentally not reading a label or because of human error. Now, yes, I wish we lived in a perfect world where that didn't happen, but it doesn't. I didn't mean to harm Ethan, but he did have exposures because he was a little boy and he would roll off and steal someone else's dummy, never have one at home, put it in his mouth. They'd had milk and he would have hives, but just hives, and sometimes I think when you keep your child so ultra safe, you're doing a fantastic job, but it can build actually in your brain more worry about the what ifs. Well, I got told that next time they're going to die, or next time it's going to be even worse. So I think in a way I was desensitized against the reactions because I saw many of them, and probably we had a nicer quality of life because of that, to be honest. Sometimes I think, when you overread, you can get more anxious. My other top tip is be very, very careful who you're following on socials, or don't follow at all, because the algorithms hate you. So the moment you start looking, all I get at the moment is, are you over 40 and menopausal and feeling a bit fat? And I'm like, yes. And you start seeing this over and over. So you will see all these fantastic allergy groups and bloggers and stuff who, yes, have purpose, but also all it does is it means every day you're logging onto Instagram or Facebook or whatever, which is meant to be a fun platform, really. And you are seeing another death because it's been shared, or another thing you didn't even think about to worry about, which probably, if no one's told you, probably isn't a huge thing to worry about. And it can really, really negatively impact quality of life. So remember, just because you're seeing it all over socials doesn't mean it's happening all the time. It's that thing called attention bias that, people are only going to be listening here if they're even vaguely interested in allergies. Otherwise, they're probably going to turn off on and go, I don't need this one. I'm going to listen to the one about how to prevent burns or something, But if you are, as soon as I'm at home, if I hear the word allergy, my ears prick up and I'm watching the telly, I can hear it. And you'll be tuned in thinking, all of these deaths happening all the time. The reason that we even hear about them on the news is thankfully because they're rare. So I just don't want people to feel like this is all your child's life is about, because they're so much more interesting than their allergies. The allergies is a part of them that you can live with, and they can live wonderfully well. You just need to know a few tips of how to navigate it.
If a child has a diagnosis of an allergy, is it then common that they would have a prescription EpiPen or auto-injector as part of their sort of care pathway? Is that now a typical plan, or?
No, it isn't. And actually, some of that data from Paul Turner showed that in the 3% who had anaphylaxis, only half of them got given adrenaline auto-injectors. So, which is quite staggering. So the guidelines from certainly within the NHS, would say if you've had anaphylaxis before or you're asthmatic, because that puts you at higher risk, they should have adrenaline auto-injectors if they wish to have them. There's a group of, if you're traveling or you live somewhere really remote, possibly they should have them. Or if you've reacted to the tiniest amount, which not everyone would know, to be honest, because it doesn't mean a dab of peanut butter, because that's quite a lot of protein, but it might mean I've touched a surface, touched my face, and they've had a reaction. They should be considered. Now, a lot of families then get really upset and they sort of say, oh, but you've just told us that anyone can have anaphylaxis. There's no such thing as a mild allergy. I think it goes back to around this 8 out of 10 reactions will self-resolve. Most of the time, your ambulance is going to be there. This is quite hard for people to hear. There are some thoughts that if anaphylaxis happens outside of hospital, even if you have adrenaline, if it was going to be one of the catastrophic reactions, adrenaline may not make a difference anyway. And so I was at an advisory panel last week, and they went around the room with all these top allergists saying, would you want adrenaline prescribed if you had a food allergy? And they all said no. And so I just think there's another piece there that families need to know, is that yes, anaphylaxis can happen. Ethan had it twice, didn't use EpiPen either time. And for most children, they will get better. Now, I think it's so much more complex than that. It really is. It's very difficult because we don't know all the circumstances of, well, all those that got better, did they get better because you used adrenaline or not? And we just don't know the full range of data around it. But it's why not everybody is reaching for their prescription pad for you. It's not because they're asking you to put your child in harm's way. And there is also a big study that showed that when people were prescribed adrenaline, their quality of life was actually worse because they now were like, oh, my child's allergy is this severe, I need it. And it had a negative impact. And I've actually seen that in practice. So the way I like to manage it with my families and adults is to discuss, this is kind of the data that we know. What do you feel is right for you? And I think that's a much better approach, because if you've got a teen saying, oh, look, I'm not going to carry it, but they're still taking safe measures. They're not, randomly eating everything and they've not got hideous asthma. Then there's a balance of, okay, that's probably okay. So it is a complex topic, but there isn't a right or a wrong. So I think I just want families to realise that perhaps the reason people aren't prescribing it is not because, they don't care or they're not hearing you. It's because there's a more complex topic behind the scene that we just don't know whether adrenaline really is the be all and end all in a community setting.
It sounds like there's a big journey happening in the whole world of allergy to understand. I've got, I was thinking about, as you were talking and thinking about the future for people and, about you worrying about your children and whether they're going to carry an EpiPen with them and all that stuff. Can you grow out of an allergy? So can it go away, or is it that's your sentence as such once you've been diagnosed as a baby or a child?
It can go away, and it does for many, and that's why in the early years a lot of allergy centres might see them yearly till they get to school age, and then either discharge and say refer them back in a few years, or every 2 or 3 years. So peanut and sesame and tree nuts, around a 20% likelihood of outgrowing it. Milk and egg is much higher. It's sort of 60 to 70% by school age. But if you actually look at the number of adults with food allergy, again, hard to pinpoint, but probably around 1 to 2%, whereas there's about 5% of children with a food allergy. So you can see that there is a very good likelihood they will outgrow it in time. I also just want to say, because I'm just picking on your words, because that's what people might remember, because you said it's their sentence. It's just part of life's tapestry. Part of my life's tapestry is I had breast cancer a year and a bit ago. So it's what made me me. I had food allergies. I've outgrown them. Ethan had food allergies. I think, why did that happen to us? Well, I think it happened because it set us on this path to be able to help others. I know that's hard with a health condition, but we don't understand the reasons for everything in life. But you really can. I've got a lovely friend, and she said to her daughter, who's got really significant allergies with lots of episodes of anaphylaxis, she said to her, your food allergies are the least interesting thing about you, darling. And I thought, you could take that totally the wrong way, but she's absolutely right. This kid is beautiful and bright and smart and the kindest person in the world. And the food allergies are just a part of her. There's just or something she's got to navigate. Just like somebody else has celiac disease and has to navigate not having the gluten, and someone else has diabetes. They're just part of what makes us, but they can still have fantastic lives. That's what I want to stress about food allergy.
Helen, that's brilliantly put. That's brilliantly put. And in fact, towards the end of the podcast, I ask every guest for their takeaway, and I think that might have just been it, because that's just so important. I did have a question for you about testing, because you talked about algorithms in social media, and we can be fed information now, can't we?
Yeah.
That feeds our anxiety, can feed our health concerns. It's one of the whole reasons that we started the Family Health Podcast, was because we commonly get asked at classes questions that are fueled by misconceptions. There seems to be a rise, or it's certainly a visibility of the home testing. So you can just order a kit online,
Yeah.
and then you get a report. What's your thoughts? Are we wasting our time? Do they have a place in allergy? What do you think professionally about them?
They're tricky. They probably have a place if you use the right ones.
Okay.
So there are certain ones, I'm going to mention it. The York testing will claim that they're testing for allergies. So, and they do check the IgE, which is what we check, the IgE to milk or egg or whatever the food is we're talking about. I've never ever find them accurate compared to our lab tests, the NHS tests, our skin prick tests. So there's the accuracy concern. I use a home kit that I send out. Why are they helpful? Sometimes they're helpful if you're an adult and you've not got the answers you need and no one's reassessed you and you really want to know. I haven't been seen since I was 10. But the problem is, you're not a specialist. These days you can put it through ChatGPT, but it still won't necessarily give you the right answers. Like, how do I analyze this food that I've never eaten? Certainly for young children, if you try and order it on my website, because we've got a home kit we use that I've got a validated lab, we will flag and it will say you can't order it for a child. Why? Because if that child has never eaten the food, we're going to open up this massive can of worms they don't know what to do with. And no parent has ever said to me, oh, I'm so glad we had screening for food allergies for my child with eczema, because now I don't know, is that positive test truly mean you're allergic or not? So either you have to pay for very expensive food challenges, because the NHS won't do it. They'll say, oh, well, probably on balance, you might be allergic, so we'll just avoid it and see what happens. And the avoidance means you're more likely to become allergic. So people do it because they're desperate. They do it because they've got unexplained tummy symptoms, random hives that can occur spontaneously, believe it or not. They're not getting answers. They've got eczema that is not managed well, with no one explaining that that's not caused by food, but they think it is. And that's why they go to these tests. When we need more specialists like me to help you go, right, let's look at the history here. Okay, actually, yes, we should do this test, or no. And GPs can do some blood tests for you. So if you really wanted to know what are the triggers of my hay fever, you might have to explain to them why you need that, but there is an argument for that, and they can do that. If you're an adult and you think you've just had a reaction to peanut, while you're waiting your appointment, they could do a blood test to peanut for you. They might be loath to do it in a child just because of the complexities of getting a child to hospital for a blood test. And we are told as GPs only do it if we have the skill set to analyse them. And I think that's important. I've had lots of people being told, oh, you're allergic to X, Y, and Z based only on a positive test. And no, they aren't, because they actually can eat it without symptoms. So getting proper advice is really important. And the good thing about socials is you get me on there. I'm at Dr Helen Allergy. You've got Professor Adam Fox on there. You've got some quite good American allergists on there. Take a little bit with a pinch of salt the differences between countries, like I've talked about with the anaphylaxis.
Yeah, okay.
But follow them, listen to their lives, look at their resources as well, ask questions. Anaphylaxis UK, Allergy UK have helplines. Contact them, look at their leaflets. But and ask for an allergy referral if you think that you definitely have allergies. There are allergy centres across the UK. You just, depending on where you live, you might have a wait, unfortunately.
Helen, that's really helpful. As I alluded to just now, said that when we get to the end of our podcast, we always ask all of our guests for a takeaway. And there's so much, isn't there? There's so much information that you want. And we will, because Helen's given some really important reference points as we've been chatting today. And we'll make sure they're all in the show notes so that you can click through and you can have a read. And some of those individuals that you mentioned, specialists that people can look up and follow online for more accurate advice than perhaps they may have seen already. We'll make sure that's all in the show notes. But Helen, if it was possible to give us one tip or one piece of takeaway for somebody that's listening to this podcast with us today, what would you want them to take away from our conversation?
Oh gosh, that is lots, isn't there? I'm going to give 3. Sorry,
That's fine. That's fine.
I'm gonna live. It is not a life sentence. It's just a part of the tapestry. You can absolutely live well with food allergies with the right support. If you are struggling, ask your GP. If you're not getting the right answers, go and ask another GP. Ask for the right referral and get the help that you need. And 3, around the anaphylaxis piece, because I'm aware I've made it complex, we still know that the best opportunity of preventing any death is the early administration of adrenaline. So please don't just think, oh, well, Dr. Helen said they're going to get better anyway. Please do use it early, and we know then that they would have a very, very good chance of recovery. It's very safe given intramuscularly. It will not cause harm. So if you're a standby and that you see someone having a reaction, use adrenaline into the thigh, completely safe to do so. So I'm not saying don't use it. I'm saying don't leave it to chance. Just use it if you've got it.
Brilliant. Helen, it's been an absolute pleasure to talk to you, and I think probably we could talk all day. There's so much to cover. So yeah, there is, isn't there? It's such a big subject. But thank you for being so frank and honest about your own personal experience as well with the journey, because it's a tough world being a parent or a carer out there, and all the things that we have to manage. And I think having resources and having individuals like you is so important for us to be able to work our way through that muddy water that is parenting. Folks, you've been listening to the Family Health Podcast, and we will share the links to Dr. Helen Evans-Howells' clinic so that you can see the more information from Helen as well. And I've got a little request actually for you, which is that if there is a health-related subject, and this allergy today has been one of our most requested subjects, hence why we've been in touch with Helen, is that if you've got a subject around family health that you would like us to cover on the Family Health Podcast, please do get in touch to make sure that we're providing the information that you are most interested in and applies to your life with your family at home. Don't forget, you can subscribe to the podcast as well across your favourite, wherever you get your podcasts. Make sure you subscribe, because it means that each week our episode will drop into your playlist. And also, if you want to see what Helen looks like, some people like to watch our podcast we've been recording today, so you can watch the podcast over on the Family Health YouTube channel. Thank you very much for listening. You've been listening to the Family Health Podcast by Mini First Aid. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.